Good evening, everybody. First, I want to introduce myself. My name is Michael Duarte. I'm with the Madera Coalition for Community Justice, and I will be your moderator for tonight's webinar. This is the third of a six-part series addressing hospital closures, and today we'll be featuring Dori and Cecilia. So again, thank you for agreeing to join us today for this evening's discussion of the miracle in Watsonville, where the community saved this hospital from closing. So before we begin, I just want to go over some updates and some ground rules. Just want to let you all know that we will be taking a break next week from this series, and we will start up on June 8th. That's because we're obviously going to have a holiday coming up on Monday. So we will start with a brief presentation from Dori and Cecilia, and then halfway through the webinar, we'll open it up for attendees for questions. I just want to remind everybody that you can post your questions in the QA section. Just raise your hand and we will unmute you. Additionally, we will provide a link in the chat that directs you to a discussion board that we have set up where you can post more questions and engage with community members. So again, let's kick off with some introductions. Could you please introduce yourselves?
Be happy to. My name is Dori Rose Inda, and I, up until very recently, a few weeks ago, was the Chief Executive Officer of Salud para la Gente, which is the community health center located in Santa Cruz County and serving North Monterey County and Santa Cruz County. And some of our sites, our admin and clinic, are co-located on Watsonville Community Hospital's campus. So I am very happy to be here this evening.
And I'm Cecilia Montalvo. Up until about a year and a half ago, I was retired as an avocado farmer. But I did have a 40-year career in the healthcare industry, both within health systems, in business development, as also as a healthcare investment banker serving the not-for-profit hospital industry.
Great, thank you for that, you guys. And I understand you have a presentation, so go ahead and take it away.
We have a presentation. Cecilia and I will be tag teaming a little bit on these slides, but we hope that it gives you background, history, context, and then really what process we went through in order to what you called a miracle, what I would call the results of a whole lot of hard work by a whole lot of people, which is saving Watsonville Community Hospital. And to start off, the hospital was a community hospital in Watsonville, opened 100 years ago and serving the community. A little over 20 years ago, it was sold to a for-profit. It went from a community hospital to a for-profit. In terms of Watsonville, if you haven't been to the area, as a bird flies, there is another hospital, probably only about 15 miles away. But because we're located on Highway 1 and on the coast, in terms of traffic, it really takes close to an hour, much of the day, to be able to get to the nearest hospital. Watsonville Community Hospital over the years, serving a community that is, currently and over the past couple decades, primarily immigrant, definite service and agriculture related employment in the area. Many people speak Spanish, more recently indigenous languages, and English is second language, or they don't speak English. And so the hospital and its staff over the years certainly was available and able to serve that community. Also, the Pajaro Valley has a younger population than some of its surrounding areas. And so most babies born in Santa Cruz County have been born at Watsonville Community Hospital. And when you refer back to how long it can take to get to one of the neighboring hospitals in any kind of an emergency, including in childbirth, that 1 hour time is really not acceptable. It is a primarily lower income area, and so there's a large population of Medi-Cal covered community members and patients at the hospital, and then also a large number of Medicare. So the hospital is challenged financially because the payment systems for Medi-Cal and Medicare make it hard for hospitals to break even. It is one of the largest employers, and with about 600 staff of all levels and healthcare professionals, et cetera. And more than half come from the community. More than half of the employees are actually from the community. So as I mentioned, a little over 20 years ago, the community hospital was struggling after the earthquake. It faced further challenges, and there was a decision to sell it to a for-profit system. And in at least at that time, and I think currently, when a community hospital is sold to a for-profit system or hospital, the Attorney General's office oversees the sale, and it did at that time. It did a couple of things. It created a health trust with the proceeds of the sale, and it also gave that health trust a right of first refusal. Over these last 20 years, that same for-profit owner transitioned sort of through a number of affiliate shifts that caused about 20 different administrative changes or administrative replacements over those 20 years. So a lot of turnover, a lot of change, and out of state ownership that was not looking closely at how the hospital could be invested in over time, nor how it should be directed in growing responsive to the needs of the particular community there. And then finally, affiliate after about 20 years, the owner decided to sell, which triggered the right of first refusal. The health trust did exercise it, but had only about 45 days to do due diligence, which is not enough time to really do much. So a very small LLC purchased the hospital and simultaneously sold the hospital to a real estate investment trust and leased back the operations. There was still a sort of call to action at the time that it sold, which, even though the 45 days for due diligence wasn't enough, it did get started a process of really looking at what if there were more time would be needed to sustain the hospital. We had a little bit of a sense that that it was struggling then, and it was likely to continue to struggle. That's what the reality of small hospitals was already telling us in that at that time. And of course, COVID made things even harder. And in 2021, the end of 2021, the hospital actually filed for bankruptcy. I think this slide is yours, Cecilia.
Yeah, I'll take over and I'll go really fast because there's a lot of words on these slides. Just giving you, some of the pressure points that were on Watsonville at the time. Community health systems is headquartered out east, and here in Watsonville, there was just this revolving door as CEOs. I think there were 20 and 21 years. So leadership didn't stick around long enough to get anything done, and the fact that the real estate itself had been sold off and then leased back, there's a very expensive lease there that was also driving pressures. It was a very complicated lease too, because that leaseholder had some reserve rights if rent was not paid, and we'll get to that in a minute. But when I say things weren't getting done, you're talking about your managed care contracts, just your operating practices. Everything was sort of deteriorating because you'd start something and they'd be gone. There was as much as $10 million in uncollected fees at the time of bankruptcy. And again, Dori talked a little bit about the pressures of COVID, but suffice it to say, in that last year, they lost $22 million, which is just an astounding amount of money. But as I said, when they defaulted on their lease, the REIT, the real estate company, actually had the right to take control, and they did. And so they brought in Prospect, which some of you may know. They're a healthcare management company, but they do also own and operate some facilities. And they did, to their credit, recruit permanent leadership there that was in place through the bankruptcy, and they did somewhat improve performance. But the REIT, the real estate owner, brought in a restructuring firm, which is very common. Some of the other hospitals in California that are going through similar pressures have firms like this. They come in, they become the hospital's fiduciary, they take over operations, and they're typically brought in right before a bankruptcy. So, Dori, tell everybody about the project.
Yeah, so I mentioned that even though the health trust did not purchase the hospital with its right of first refusal, and it did sell to the small company that ultimately that sold it to the real estate investment trust and ultimately was replaced by Prospect. When that right of first refusal, when the purchase didn't come to fruition out of that, we were really able to come together and start thinking and looking ahead. And we did just in the background, very quietly, did some research looking at how similarly situated hospitals across California do well or don't do well, and there aren't a lot of stories of doing well. So it was more like, you know, looking at different pieces of things that work or don't work. And as we were able to do that over the year and a half prior to the filing of bankruptcy, the leaders of the key stakeholders that were doing that research, so that our county, the county of Santa Cruz, our city, the city of Watsonville, the health trust, and the clinic, did come to the conclusion that a healthcare district was the right direction for us. In other words, really to return the hospital to community ownership through the formation of a healthcare district. As we hit the ground when the when we were aware that the operator had been ousted and the interim operator had been placed there, we really dug into what that meant. And in general, when you form a healthcare district, it's done through a public vote, and it takes about 18 months. And we did not have that. We barely had a few months ahead of us to be able to strategize. And so we made a decision to connect with our legislator, and we had seen that it was possible. It had been done at least once to form a healthcare district through a legislative process. And with the incredible commitment of both our legislator and our community, we were able to form the healthcare district in a very short amount of time. We did that through the nonprofit, the Pajaro Valley Healthcare District Project. So we formed a nonprofit in order to take all the steps necessary to form a healthcare district. So that PVHDP was the nonprofit that those four organizations came together, formed in order to do all the work that was going to be needed to form the healthcare district and purchase the hospital out of bankruptcy. The map just shows the outline of the district itself, and we chose to mirror the Pajaro Valley Unified School District's geographic limits, with one small exception, that we had identified a particular area that might make it hard to move as quickly as we needed to, but otherwise it really it is the mirror of the school district.
So I'm going to try and go quickly, but go through a little bit about the process, because this organization that we will from this point forward just refer to as the project, sponsored by the organizations you heard about. One of the things that I reflect on is that this was a group of, influential people, but they were also extremely nimble. So when something needed to be done, nobody, spent, they functioned on a really intuitive level and they were able to act fast. We actually submitted a stalking horse bid to buy the hospital, right as the bankruptcy was being filed. So we went in with a bid to buy, even though we really had very little money and had no idea where we were going to get that money. But we did win the bid and the court approved our bid. And we had a deadline of August 31st to close on it. And it was just daunting because we launched a community campaign to raise money in March, and we had until August to raise $63 million.
And I think what you're hearing is that there were a number of, it was continuous, but there were layers of community engagement that happened. And so stepping back to just the formation of the nonprofit and the engagement of our legislator and the commitment to form the district through the legislative process. Can you go to there we go.
Yeah, I sure.
We had to really engage and activate at all levels of the community. And so we were creating a sort of larger and larger circle of what you might call advocates or ambassadors that we were able to reach across industry, government, healthcare, and CBOs, and really targeting conversations and listening to our partners about why the hospital was important to them from all of those different lenses, and facilitating their ability to speak up and to advocate both in particular to the state, as we were really working on getting the district formed, and also to the state in order to get the funding requests that we had ultimately approved by the state really quickly. So you can see an incredible cross section of support. You are probably familiar that sometimes the interests are not aligned across these areas of industry, government, healthcare, and CBOs, but for the purposes of the essential access to hospital services in the community, there was a really very strong and very aligned voice of support across the community.
And I think beyond that coalition, which was just so very important, one of the really most important investments that the project made was to hire a firm to do a really thoughtful business plan, because almost every donor, whether it be government or a private individual that we spoke to, they were sophisticated investors, just as though they were investing in their own business. They wanted to know that they weren't throwing their money away. And here's a hospital that had lost $23 million. So we had to convince ourselves that a financial turnaround was possible. And then we had to convince all of these very important organizations that helped us that it was possible. And it was very rigorous. It was extremely rigorous.
Before you go to this slide, I just want to add, I would say even further that there was, I talked about aligned support, but there was also a lot of hesitancy because people had invested in the hospital as a community hospital before it sold. They had watched it struggle for years. And so even though there was a very strong voice of support when it came to, as Cecilia was saying, when it came to investing, to committing the funds from any of the sectors that I mentioned, we had to not just demonstrate, but we had to convince that there was good reason to believe that things were going to be different. Go ahead, Cecilia. Sorry about that.
Sure. And I'm seeing a question in the chat about how do you do that as a community member? How do you build all of these partnerships? And I will tell you, I think Dori and I had well over 500 meetings, but it wasn't just Dori and I. It was that we would have a meeting, present the business plan, talk about how important this was, and then we would, if we were able to get support from an organization, then this was a networking exercise. It was It was, you should talk to XYZ, and you just went from there. It wasn't done on a computer. It wasn't done during social media. It really, by and large, was face-to-face, one-on-one meetings.
Yes, and I think if going back to who started the planning process, the county, the city, the FQHC, and the health trust. It wasn't just the leaders of those, it was the health department of the county. It was their council, their staff, their administrative staff. It was the CAO from Salud. It was our compliance department. It was our fund development department. From the trust, it was their entire grants and fund and donor development department. So, and the city as well had invested staff. From there, the CBOs, we had, volunteers and colleagues and partners that were doing the work day to day of producing what we need to demonstrate and to organize and demonstrate and speak to all of those meetings and all of those folks, and to find the right people. We spent a lot of time identifying key business leaders, and we would work to develop the confidence of that trusted key business leader so that he would be able to partner with us and again really move more quickly that confidence, and the same across government and the same across our CBOs. And I think because of COVID, I will say we had worked so closely together during COVID that those coalitions that were formed, that rapid response and communication that was formed during COVID, that we were still in COVID, those also created sort of the highways of communication and confidence that was needed.
And I see that somebody else wanted to speak to this question. Am I reading that right? No? Okay.
No, you're good.
Okay, good. So now I'm gonna, let me close this. I'm really gonna go quickly. I wanted to really prove the point about what the business plan consisted of. And I'm not gonna go through these, but there's really only 3 ways to turn around a business. You're gonna either increase revenues, you're gonna decrease expenses, or you have some other magic rabbit that you're gonna pull out of a hat. And our business plan really had a little bit of each, but I would say some of the biggest initiatives, we were determined to build revenue by renegotiating those managed care contracts that hadn't been touched in years. It's a hard thing to do, and it was actually a hard thing to convince people we could do, but it was a really major driver of our business plan, as was the management of labor savings. And that was tough. Labor was our partner in this effort. And so that was something you see, it's just in a lie, you're going to reduce supply costs, you're going to do all these things. We would speak to these issues in detail. We had an accompanying financial forecast, and incredibly, our forecast showed that Watsonville Community Hospital, by the end of the first year, would have positive cash flow. And I'm going to tell you the end of this story in a minute, but that's a hard thing to I don't even know if everybody we talked to actually believed that. But in the end, they stood behind us and wanted to help us make that happen. And we were very clear about the risks, that transactions of any sort can interrupt cash flow. You're changing billing entities. It can just stop your accounts receivable. We were counting on these insurance companies, which are typically not friendly, et cetera, et cetera. And we knew we needed strong management to pull this off. But, in the end, I want to sort of get back to all the money we had to raise. I think in the end, we actually targeted almost $67 million that we needed. Very little of it was purchase price. The second line item, a lot of you may not be familiar with bankruptcy. I hope you're not familiar with bankruptcy. There's something called debtor in possession financing. Some entity has to keep the hospital open while this is going on. And that's usually through debt. And usually organizations are not really excited about issuing debt to bankrupt entities. In this case, it was the landlord. It was the real estate owner. They had a lot to lose in this deal. They issued debt But in order to take it out of bankruptcy, we had to pay it off. So you see 25 million of our acquisition cost was to pay off operating costs. But you also see that we spend a lot of money on professional advice. We also had targeted to leave the hospital with some working capital on the balance sheet. You know, they couldn't just go into business with nothing. So we targeted $10 million. I want to show you where some of the major investment came from. State of California, 25 million. Remember, California had a surplus last year. You'd be hard pressed to get 25 million this year from California, but they had money to spend that the governor and the legislature wanted to spend on one-time projects because they couldn't bake it into an operating budget. And we were really lucky with our timing. But we had counties, that community health trust. We had some very generous individuals who didn't even want their names mentioned. We had health plans. So you know what I realized? I left off Blue Shield of California. So both the Central Coast Alliance for Health, which is our Medi-Cal managed care plan, Kaiser Permanente, as well as Blue Shield, these insurance companies all helped us out. Driscoll's very major employer in the Wattsville area, obviously, you know, strawberries, all kinds of berries. I had to name Roland and Pat Rowley, the single couple that gave $1 million. Other donors, 6.2, and then we were able to have 3 million that was already on the balance sheet when we closed. So we ended up raising 63 out of the 66, 67 that we meant to. We were a little short, and unfortunately that did short the hospital a little bit in the beginning in working capital. They are doing okay now, but so we came pretty close. And you know, this probably shortchanges the effort because what is lists like 10 different sources. I think we actually had 500 different sources. So that line item with the 6.2 million included checks from $10 to $100. It was really, really breathtaking to see the number of people who wanted to help. Dori, talk a little bit about this, because this may actually apply to other hospitals that were trying to launch this kind of effort.
So while we were fundraising, we were really struggling because it's very difficult to do a hard, large capital campaign and tell people that not only are we looking for big dollars, but we need it right now. And by the time we are asking people, it's in the middle of their fiscal year. They've already either designated, spent, or made plans with the funds that they had. And so we were not able to say to people, that's okay, we'll take a pledge for next year or the year after. We were able to work with the Packard Foundation on a loan in which basically they provided us the funding that they allowed us to go into a pledge campaign, and that they provided us the cash up front, the equivalent of the pledges that were made over 2 to 3 years, and our community members were able to, instead of only being limited to what they could provide in the current year that we were fundraising, they were able to make much more generous commitments over time. So that was a very significant turning point for us in this campaign that made it possible to kind of get to, maybe not cross the finish line, but get close enough to the finish line to finish the process.
No, I actually think this did. I don't think if we didn't have this, I don't think we would have closed. And it was because the hospital would not have had enough working capital. So it was very generous. It's basically using pledges as collateral, but they fronted all that money. So the question is, how are they doing now? You know, they're not rolling in money. Don't make any mistake about that. But they are performing to plan. I'll cut to the short. We were supposed to get 11 million from payer contracts, 8 million from labor, blah, 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 all of these things. We actually ended up getting 12.1 million from managed care contracts. I mean, it's just stunning. We only had really one key message, and it's probably relevant to all kinds of small hospitals in California. Our message was, we want to be paid what every other hospital in our area is paid. We don't want to be shortchanged because we're not a part of a system or because we're in a poor area. You just pay us fairly. And we were prepared to make it very public if they said no. After the campaign we had just won, we would name companies if they weren't going to agree to pay us what they pay hospitals down the road. And I'm just really proud that we were able to make this happen. But one more time, I'd emphasize we hired and paid for a really top-notch firm to do this work for us. So some of these investments in professional help are really, really paid off for the hospital. In not in exactly the same way as we thought, but we did get the labor savings. It just didn't come exactly from what we thought. A lot of what's going on now is we're coming off of COVID. These hospitals have a history of having a lot of registry inside. That is ending naturally. But we did pick up a lot of money, millions of dollars in savings from the almost elimination of registry and some of these other things. We, obviously were able to terminate Prospect. They had been clipping it at $250,000 a month. So there were opportunities. We absolutely have improved the revenue cycle. We hired great people. I actually am stunned by the quality of the people we've been able to hire. A lot of people would kind of go, ooh, I don't know if I want to put my career on the line for this, but a lot of people did. We recruited some really great people, and it made all the difference in the world. And we've been able to make some investments. So we were able to buy a new robot, which really increased our surgical care. We got a new GPO contract. And then, of course, there's just the tax exemption itself. Creates sales tax, but there were things that didn't pan out. Make no mistake, in our business plan, we said we were going to reduce payments to physicians who were on call to the ED. Don't ever build that into your business plan. It's just never going to happen. I really underestimated how hard that would be. And, we still have a lot of work to do with various leases. We have a physician group that's still losing a lot of money. I think there's prospects for the future, but I just wanted to show this because it's not as though everything we said was going to happen happened, but a lot of it did. So this is right from the CFO of the hospital. She made this presentation to somebody else, but the impact of the things that they really did do totaled up to $29 million. And so this year's budget, they are kind of going back to what I said about the first year. At the end of this year, they are cash flow positive, and they have budgeted for $3 million of cash flow next year. Like I said, not rolling in money, definitely not for a hospital of this size. You're talking about almost $1 billion. Well, they are $1 billion organization this coming year. Having that.
No, go ahead and finish. So I'm just going to reference a question that's in the Q&A.
Oh, there's another chat.
It's in the Q&A. Do you see that?
Yes, we do have a question there. Can you repeat?
Yeah, I'll if you can't see the question, it's a really good question. The sense of institutional donor willingness to donate to a hospital that's losing that kind of money, and also in a county where all the privately insured patients go elsewhere, that is identical to what is going on in Watsonville. We're trying to improve that, but yeah, I mean, the Medi-Cal patients typically do go to Watsonville, and there are plenty of insured patients around the Watsonville area. There's wealth in the Watsonville area, but they go somewhere else. And we have to earn their trust back. There was a lot of reputational damage that was done at Watsonville during the time that they were operated by a for-profit. And so that's just going to be building.
I think
it's amazing how much, if you increase rates for even a small amount of privately insured patients. They said we got $12 million off of like 10% of our patients. And that's a very typical scenario for a disproportionate share hospital. And
in terms of the strategy though of reaching across all of those donors, when I talked about listening to each of them, our healthcare partners had an interest in supporting Watsonville Community Hospital because the population that the hospital served, the Medi-Cal population, if it closed and that business were to transfer over to their hospitals, it would have been devastating to them. Their balance of how they bill and how they charge and how they break even with revenue would have been really put at risk. And so there was a motivation to support from their lens to make sure the hospital stayed open. So that's one lens. And then our business partners, they had a motivation to make sure that their workers who either chose to or weren't or their families weren't receiving commercial insurance through their employment would have a hospital to go to. Keeping their workforce healthy and available was really important to them. And so there was also a commitment and an interest in investing in the hospital. And I'm not saying that was their only interest, because obviously, there were also hopes that Watsonville Community Hospital would become the hospital they knew 20 years prior, the one where many people had been born, and wanting to see its quality return and its services return to that. I am just pointing out that there is a strategy and a method to identifying the particular interests from the different categories of investors and donors that is work that has to be done. And in answer to that question, I would say we spent a lot of time really thinking through how the loss of the hospital would affect the county, how the loss of the hospital would affect local industry, how the loss of the hospital would affect our healthcare partners, et cetera, et cetera.
There was another comment in the chat about just how much money was involved here. Yeah, it's a stunning amount.
It's mind-blowing. I come from federal, a community health center. Prior to being in a community health center, I was in legal aid. It was mind-blowing to me. I mean, the community health center, I've been desensitized to the cost and expense around and the money that flows through healthcare, but in the hospital business, it was, just sort of exponential. But it is what it is. It is what it is right now.
Yeah, and I would also, that's right. And I would also note that bankruptcy is expensive. So many of you may know that Hazel Hawkins in Hollister declared bankruptcy on Monday. And, I am sure weighing very heavily on their minds was the actual cost of going through bankruptcy. It's, you have to spend a lot of money to get out of bankruptcy.
And there's a savings to the restart that is allowed, the getting rid of debt, the being able to start contracts over, that is a benefit. And probably we couldn't have made it without it, even though bankruptcy was very costly, it also made it possible for us to come out of bankruptcy in a way that was going to reach the goals that Cecilia has gone over.
There's a question in Spanish.
Okay. How much time do you believe it will take to recuperate the trust of the community? It's already happening.
Good job, Dori.
Oh, thank you. It is already happening. We are hearing stories. The district is going through a strategic planning process, and it's giving opportunity to hear stories from the community. I heard them in those sessions. I heard one earlier today at a meeting. I have already forgotten what meeting it was, but we are really hearing people starting to tell stories to other folks. So, word of mouth that they had a really good experience at Watsonville Community Hospital, and then other people, again, choosing to go to the hospital. Again, we've heard about it from folks who have had emergencies, have been into the emergency department because of heart or other kinds of urgent needs. We're certainly hearing it consistently from our OB program. So it is really, it's slow and steady, and it's very inspiring to hear, and I think the staff of the hospital who, boy, they have hung in there through what I would say hell and high water. And one of the physicians that I spoke with today said hell and high water at the same time. They are starting to see glimmers of hope and really starting to feel more confidence. And the leadership team there, as Cecilia mentioned, is strong and building its expertise, and it's getting even better, and really driving that confidence internally from staff. So it's a great question, and it's happening.
Mm-hmm.
It's exciting.
No, I think the whole process really invigorated the employees. I can't tell you how excited they were. You know, most of them had never worked in anything other than a for-profit hospital, because it had been 22 years. And they were just really, really excited. When we would do town halls or walk through the hospital, you know, just constantly reminding people, you own this hospital. You know, if you are a member of this community, you own this hospital. I knew this question had to come from somewhere, whether it be Madera or Hollister, or are they similar? Is Madera similar? Is Hollister similar? I'll add Hollister because I think that question is out there too. I am absolutely certain there are a lot of things in common between Watsonville, Madera, and Hollister. I think we know that there's some demographic similarities. But you know, I think what you'll hear is that there were a lot of situational, unique things in Watsonville that may or may not be the same somewhere else. And the fact that Madera has closed, I think, presents some pretty, I mean, it's a challenge. And I have spoken to the CEO there several times. If they could have avoided that, I know they would have, because you know, you're starting from scratch. Then we didn't have to start from scratch. We were changing ownership. Once it's closed, you have to get a new license, you have to reassemble a workforce, you have to get new provider numbers, and you'd be astounded at how much time and work that is. So I expect that if Madera is successful, it might be harder than Watsonville was, which is a tough thing to say, but it may be. In Hollister, you know, they're all very different. Hollister is interesting because they're actually not losing that much money. They have some balance sheet issues that really put them in a pickle. I know that the community there is very concerned about the management and the board. And you know, I think in both cases, could the community actually, I'm going to flip to my final slide. Could the community come together and make something happen? I would never say no. That because I actually, part of the reason that I came out of retirement and kept working with Dori was because it was just so, I regained my confidence in people and what people can do if they work together and they're committed and they're thoughtful. And I have no doubt that exists in other communities. And that's what made this happen.
And I think I would add that we really needed the 18 months prior to the bankruptcy. So that the time between the sale of the hospital to that small LLC that ultimately failed, we needed that time to plan. And I understand the same as what Cecilia is saying, that it's it's more work to open a closed hospital. However, if I step back and really just think from a 30,000 foot level, that it takes about 18 months to reopen a hospital. You would need that amount of time to what you just heard was so many different pieces of work and layers of engagement and just planning and pivoting And it takes at least 18 months to really be able to put that together. And so in some ways, the time that it would take to open a closed hospital does create that space and that time to identify leaders, to bring together partners, to start building that momentum and investment. And I do see the consultant, do you need a consultant for the plan? You need many consultants. It's a very expensive process to do this well, and it has to be done. It is the comments about it's a lot of money, it's a big business. It is not just a lot of money and big business, it's an incredibly complex business. And so it needs experts, firms that do this kind of work that are exceptionally expensive, and also needs that passionate, committed, heartfelt community commitment as well.
I just want to just quickly jump in. I just want to be cognizant of the time. We have 10 minutes left. I personally have some couple questions here that I would hopefully you guys could shed some insight on. One is obviously there was a lot of moving parts, a lot of moving pieces, and the ability to be agile and move quickly. Throughout that process, you mentioned that community involvement was big. Kind of, can you speak to some of those strategies? As you know, Madera is going through that. We have obviously residents. They're very concerned, and they're looking away. How can I help? How can I get engaged? And obviously, to build on that, all the complexities of the process. Where are we now? What's happening? You know, how did you keep the community informed and continue to be engaged in this drawn out process?
You know, the question that is in the chat, how as a community member can I participate? I want to help. I remember being asked that over and over again, and the thing we had to. There was parts of our work that we had to do so quickly, and so it was not as simple as, say, a large community organizing opportunity where you can really just, you know, sort of pull people together and say, you know, let's mobilize and let's take action. It was not that opportunity. Where people were able to really support, I think, was engaging with the organizations that they trust and that they utilize, and making sure that those leaders of those organizations knew they wanted them to put time and energy into it. So, you know, the Federally Qualified Health Center, which is, you know, where I worked during that process, there was not just a support from, you know, our board, who said, yes, you go ahead and dedicate all that time, take what you need of our human resources here. It was our patients who were saying yes. It was our staff who were saying yes. And that was true across that long list of all those CBOs that were in that slide, from our second harvest and our, you know, mental health and our student support and the youth support programs. All of those agencies felt supported and were able to say, yes, we're gonna sign those letters of support for the legislation. We're gonna sign those letters of support for the funding. And also, as Cecilia said, people, we had $10 checks come in. We had $5 checks come in. It was people wanted to give. They made their voice clear, and it just was unique and different from some other kinds of organizing opportunities, because it was so hard and fast.
And just to follow up on that, was there an initial organization the community immediately looked towards as being, you know, trusted in the community to say, yes, if this organization is involved, is behind this, then we will mobilize with them?
It was the 4 organizations. I mean, we were strategic about those 4 organizations, having the county leadership and the health department of the county, having the city leadership, having the community health center, all three fully in, and then the health trust as well. That was a strategic and purposed joining of entities that then were able to really move a lot of others. That question that's up in the chat right now, Cecilia is an expert and I am self-taught.
I learned so much. I was not an expert in something like this. It was just unreal. You know, I swear, I think one of the things you also have to have a lot of perseverance, because there were so many roadblocks. There were so many days it was just like, oh no, we hit a dead end, and then something would happen. We'd figure something out. And you just keep going.
It was an undertaking that had to be done with immense amounts of humility. And we had to be able and willing to look for partnership in unlikely places, and sometimes in places that would have otherwise been not a choice partner. I mean, Cecilia made a point of saying that the Real Estate Investment Trust made it possible for the funding during bankruptcy. It really was allowing there to be room for whatever the interest of that potential partner was, as long as it was something that was needed and something that was going to lead us, that we were driving in the right direction. We were very careful throughout to be drivers and not tools. And that's probably a whole talk in and of itself. But those very strong interests of all of those entities also came with the risk of us becoming their tools towards some end, which was not what we allowed to have happen.
You know, I see in some of these other situations, I see an enormous amount of politics, and I'm not sure. I think that Watsonville was super political about this. I do see it in some of these other cities. And I think that the thing that it makes me think of is how important it is to just remind people what this is about. Just bring them home. So instead of kind of going, management is just awful, blah, you know, I remember 3 years ago, this happened. It's just like full stop. It's your community needs you, you know, they need and deserve healthcare. And you know, you've got to put some of the things that you're angry about into the past and focus on the prize.
Excellent. No, I mean, that sounds like a lot of work that you guys condensed. So I really appreciate all the information and your perspective, especially, you know, as we're going through our process here in Madera, and in keeping the community informed, engaged, and not lost, and reminding the leadership here in Madera also that it's about the people. So let me check the questions real quick. We have one more question.
I'm not seeing it.
Okay.
Can I ask you a question?
You can ask me anything you want.
I'm just curious. So where are things in Madera? And what is your role in this?
Well, as a Madera Coalition for Community Justice, we've kind of want to be, we're the, you know, organization that is continuing the conversation in the community, and being the advocate for the community. As you know, I'm talking to the experts here. There's a lot of moving parts. There's a lot of questions, uncertainties. So we want to make sure that we keep our community members informed in whatever way possible, and be able to plug them in, and making sure that whatever decisions are made in this community, that they're actually involving the community members themselves. So that's what we're about, and this is part of the series that we're doing, and other things, in-person meetings that we're doing, is something that we are going to continue to do, because we want to be be that voice for the community, for whatever they might need.
Yeah. Well, they're very lucky to have people that are there to do that.
Yeah, well, as you guys know, it takes a whole community, many organizations and leadership in the community. So no, I want to say, do we have any more questions, team?
Well, there is a question that I can't answer right this second, but I will get back to you. This presentation, basically, it got revised today to be past tense. A lot of those materials were materials that we used to present before the deal was done. I was always sharing it very freely. The thing that, and I actually think it is shareable because this is a district. And it's part of what they have to learn in Hollister is that when you're a district, this is the public's information. And I don't think there's anything in this presentation that is not publicly available through other sources. So I'll confirm that, but I think I can.
Well, we appreciate that. And with that, it is 7 p.m. So I want to be respectful of everybody's time. This brings us to the end of the webinar. I want to thank you, Dori and Cecilia, again, for being so generous with your time and participating tonight. To the audience, I just want to remind that next week is Memorial Week. So don't go to work on Monday. And we will be taking the break from the series. So we'll be back in June 8th. So mark your calendars. We will be sending out notices with more featured guests, such as Assemblywoman Esmeralda Soria, County Administrator Jay Varney, and a few more secret guests. So stay tuned. So again, I want to remind you, follow us on Facebook and Instagram at Madera Coalition for more up-to-date information on the hospital closure. And once again, thanks everybody who participated tonight. We appreciate your time.
Good luck. Good luck. I wish the best for your communities.
Thank you very much. We appreciate it. Good night, everyone.
Good night.
Good night.